This portion of our series will describe the use of dissociative anesthetics. These compounds are not widely used in human anesthesiology, only in pediatric medicine, but they are important in veterinary medicine. When they were initially discovered, they were found to be very effective anesthetics in subhuman primates, as shown here. In humans, they were less successful, primarily because of their tendency to produce hallucinations and dysphoria, that is, the opposite of euphoria. They lack many barbiturate-like side effects and don't even produce an anesthetic episode that's similar to that produced by barbiturates at all. A cat injected with barbiturates is like a limp rag, depressed and completely unresponsive. A cat injected with ketamine alone is tense, has strong reflexes, and may even appear almost awake. So what are the advantages of these drugs when used alone or in combination with other drugs? The advantage of dissociative anesthetics is that they produce a very smooth and safe state of unconsciousness when used in combination with sedatives. The dissociative drugs that are currently marketed include ketamine or Ketoset or Vitalar, thalidomide, usually in the form of Tilazol, which contains zolazepam, a minor tranquilizer related to diazepam, and phencyclidine, a Schedule I compound used for investigational and recreational use only. The species in which these compounds are most widely used include the cat and horse, but combinations of these compounds with an appropriate sedative is also common in the dog, rabbits, and many laboratory animals, including rodents. The dissociative anesthetics are cyclohexanones, structures that are obviously not like that of barbiturates. They're very lipid-soluble and enter the brain easily. Their duration of action varies from ketamine, which produces an anesthetic episode of 15 to 20 minutes, to thalidomide, which with an anesthetic episode that may last for hours, to PCP or phencyclidine, which has effects that last for hours to days. They're absorbed quickly and easily. In fact, PCP is sufficiently lipid-soluble that it's even absorbed through the skin. There are stories of people arriving in the emergency room suffering from hallucinations produced by accidental exposure to PCP. They distribute into the brain within a minute of an IV injection, and they're metabolized in the liver by the P450 system in all species except the cat, where 87% of the drug is excreted as is. When used alone, these compounds, like ketamine, produce sedation only in primates and cats. They also produce analgesia by inhibiting a component of the nociceptive response that's involved in wind-up. Recently, there's been research into the use of these drugs for the treatment of chronic, intense pain and as antidepressant compounds for humans. The anesthetic effect of these drugs is perplexing because they don't produce traditional stages of anesthesia and usually need to be given after large doses of a sedative. For example, ketamine can be used alone in the cat, but not in the dog. However, a strong sedative makes a better anesthetic episode in both species. In the horse, ketamine can only be safely administered after a sedative. Given alone, it can cause seizures in about 50% of dogs and most horses. This strong excitatory effect needs to be inhibited for their successful use in these species. Once that happens, they produce relatively smooth inductions and recovery. Thalidomide is often the one used for chemical restraint in exotic species because it's more potent than ketamine, so smaller volumes are needed. So what is the mechanism of ketamine's anesthetic effect? This slide shows the classic location of ketamine-sensitive sites in the channel of the NMDA, that is N-methyl-D-aspartate, receptor complex. This channel is relatively non-selective, allowing calcium, sodium, and potassium to pass into the cell causing a depolarization. The endogenous neurotransmitter that activates the channel is glutamate. NMDA is actually the synthetic analog of glutamate that was used to characterize this channel. The inhibition of NMDA channel activity by ketamine is a non-competitive action. That is, ketamine doesn't bind to the glutamate binding site. Instead, it binds inside the channel, blocking the flow of ions. Although we know that ketamine blocks NMDA activity, the mechanism of its anesthetic effect is still not clear. The ability to inhibit NMDA receptors by itself doesn't explain their anesthetic action completely, because other NMDA antagonists have little or no anesthetic activity. So the effect of ketamine on other pathways throughout the brain may be responsible or contribute to anesthesia. We know that these drugs also increase the release of excitatory amino acids. This is thought to underpin their antidepressant effect. Excitatory amino acids increase BDNF, a growth factor that enhances neurogenesis, that is, the production of new neurons. This happens especially in the area of the hippocampus, an area involved in memory and depression. Usually, antidepressant compounds take several weeks to produce their effects, including increased neurogenesis. But ketamine is antidepressant within hours and can even reverse suicidal ideation in the emergency room. So NMDA inhibition is important, but maybe for antidepressant activity rather than anesthesia. As you can see, dissociative anesthetics also inhibit cholinergic activity at both nicotinic and muscarinic sites. They stimulate opioid receptors and dopamine receptors. They block monoamine uptake, like the traditional antidepressants do. They block a variety of channels, and they inhibit the enzyme nitric oxide synthase. Because it's not known whether these actions are important, you can simply remember that they inhibit NMDA activity, but be aware that this may be a simplistic view of their actions. To simplify, the anesthetic action of dissociative anesthetics is basically that they depress cortical areas, but allow normal activity through other sites responsible for reflexes and so forth. An interesting point is that the anesthetic action of ketamine depends heavily on the isomer used. The plus isomer produces a profound analgesia and hypnosis or sleep, whereas the minus isomer is responsible for locomotor activity and nystagmus. Injecting the plus isomer only would produce a smoother anesthetic episode, but unfortunately, ketamine is currently only available as the racemic, that is the plus-minus mixture. What are all the things that these drugs do? Regarding their clinical use as hypnotics and anesthetics, you need to consider their species variability. Dogs are sedated at low doses, but as the dose is increased, the degree of excitation is actually increased. Cats and primates are primarily sedated at all doses. Horses and mice are excited by these compounds unless they're also given a strong sedative to counteract these excitatory effects. And interestingly, they have no effect in chickens, which may be a way of experimentally identifying the anesthetic mechanism, using the chicken brain as a negative control. Dissociative anesthetics derive their name from the fact that they appear to produce a dissociation of animals from their environment, or catalepsy. But this effect is very species dependent. It's not clear whether ketamine is analgesic or amnesic. In humans, patients respond to deep pain but have no memory of it when questioned later. Profound analgesia may explain the ability to, for example, lift a refrigerator, something that would usually cause pain in unmedicated people, but doesn't seem to even be noticeable after things like PCP. Finally, as I mentioned, it appears to be rapidly antidepressant. In fact, the antidepressant and analgesic properties may be related to each other. Many antidepressants also have analgesic activity of those that are currently used. Tachyphylaxis is a form of tolerance. It means that the effect of the drug is shorter and less intense, but over a relatively short time. This is seen when ketamine is injected repeatedly to keep an animal down for longer anesthetic episodes. The effect of the second and third injection is progressively shorter. Remember that this is just the opposite of the effect of ultra-short-acting barbiturates. Their anesthetic effect becomes longer and longer with each repeated injection because of the problem with redistribution. The effect of ketamine and thalidomide on the cardiovascular system is also just the opposite of most other injectable anesthetics. In the heart, they increase heart rate by a vagolytic effect. The increase in heart rate increases cardiac output, which ultimately increases blood pressure. The clinical consequence of this is really significant because blood pressure can increase by 25%, which may cause hemorrhage in animals that have wounds. There's also an increase in intraocular pressure and intracranial pressure. For these reasons, ketamine should also be avoided in animals with head injuries or who have glaucoma. Dissociative anesthetics have little or no effect on respiration, just the opposite of most other injectable anesthetics. It's only at very high doses that respiration is inhibited, except in cattle, where respiratory function is more sensitive to these drugs. In addition to a relatively normal rate and depth of respiration, there's little or no effect on laryngeal reflexes, but the cough reflex may be depressed. But there is profuse salivation and lots of secretions along the respiratory path. This is a problem especially in cats. Usually it can be controlled using atropine-like compounds prior to the injection of ketamine. Skeletal muscle tone of animals after ketamine is remarkably intact. There can be extensor rigidity, similar to a decerebrate rigidity. This is probably due to inhibition of similar pathways. There's tonic, spastic activity or tremors when the pre-anesthetic is insufficient, and there may be purposeless movement of the limbs. The eyes are usually open, fixed, and staring, so it's important to use a lubricant or tape them shut during surgeries. Even a couple of minutes without blinking causes tissue damage and pain during recovery. You can verify this yourself by trying to go without blinking for a full minute. Another activity that the animal has is the mouth is active and the tongue is usually licking spontaneously. So except for the cough reflex that we already mentioned might be depressed, the other reflexes are fairly normal. This makes the depth of anesthesia a challenge to determine. Drug interactions are really essential to consider for dissociative anesthetics because other drugs allow dissociative anesthetics to be used clinically. In small animals, atropine or glycopyrrolate should be used to control the salivation and the arrhythmias. In the horse, xylazine or guaifenesin are usually given as pre-anesthetics to inhibit the excitatory effect of ketamine. In the dog or cat, midazolam, xylazine, or diazepam serve the same purpose. Tilazol is actually thalidomide prepared in combination with the solazepam, which acts like diazepam. While sedatives inhibit the excitatory actions of dissociative anesthetics, their depressant effects are additive. There are many adverse reactions to dissociative anesthetics. Don't be surprised by the intensity of the reaction to an intramuscular injection because it does sting and the animal will jump away if not restrained when using ketamine. There may be insufficient muscle relaxation and visceral analgesia for some surgeries when it's used alone. Convulsions can result from the use of ketamine alone in about 50% of the dogs. This emphasizes the importance of using a sedative in dogs and horses to block the behavioral excitation. There are hallucinations during recovery that may explain some of the animal's odd behavior, and there may be a dangerous increase in heart rate in dogs. Animals may be hypertonic, displaying opisthotonos, and cardiac arrest is a possibility. Often there's emesis during emergence, and the body temperature can either go down, that is hypothermia, or there may be a delayed hyperthermia in cats. The increase in intracranial and intraocular pressure makes these drugs dangerous in animals with head injuries or who have glaucoma. They're also usually avoided in animals with epilepsy because of their excitatory effects. In cases of toxicity, there's no specific antagonist for ketamine. However, major tranquilizers like acetylpromycin are very good antagonists of the adverse effects of these drugs, including hallucinations. Haloperidol, or vitamin H as they call it in human medicine in the emergency room, is a major tranquilizer that's usually used for PCP and ketamine, or special K, overdoses because it lasts for so long, matching the duration of PCP's action. At this point, you should be able to compare and contrast barbiturates to dissociative anesthetics. Barbiturates typify the effects produced by many of the injectable anesthetics, while ketamine is really atypical. Barbiturates are general CNS depressants, whereas ketamine is species-specific. Barbiturates enhance GABAergic activity. Dissociative anesthetics inhibit NMDA activity. Barbiturates are respiratory depressants, while ketamine has little or no effect on respiration. Barbiturates relax skeletal muscle, while ketamine has either no effect or even produces spontaneous motor activity. Barbiturates depress blood pressure and cardiac output, while ketamine increases blood pressure and heart rate. Barbiturates are not at all analgesic, while ketamine is thought to be analgesic and may even be used in the future to inhibit and reverse conditions of chronic intense pain. Barbiturates depress reflexes, while most reflexes are spared by ketamine except for the cough reflex. Barbiturates are contraindicated after only reserpine, and ketamine is contraindicated in epilepsy, head injury, and glaucoma. Knowing the difference between the effects of dissociative anesthetics and other depressant compounds that enhance GABAergic activity, like barbiturates, will allow you to make informed decisions about which type of drug to use for each patient.